Hello. This morning I decided to take the recording session outdoors. I hope this doesn't interfere with your ability to hear me. I've situated myself in an area where it's not too noisy and away from traffic noise. But I would like to talk about anxiety and ADHD. Anxiety is often talked about as a comorbidity for ADHD. What that means is it's a separate condition that is not necessarily caused by or the result of ADHD, but it's a condition that coexists with ADHD. And based on my experience, this happens to a lot of people, including children, because anxiety does plague a lot of children. I've seen children as young as age 5 or 6 who suffer from significant clinical anxiety. And I've always wondered whether someone who already has ADHD is physically or mentally predisposed to for having anxiety at the same time. I think in many situations, anxiety is actually the result of having ADHD because, as I mentioned before, ADHD can make your life unpredictable. Inconsistency is a very hallmark of ADHD or the outcome of ADHD on your behavior. So if you can't predict your life, how it's going to turn out, or how your day is going to be, if you're just waiting for the next disaster to happen, obviously for any natural person, that can lead to anxiety. So a lot of times when faced with someone with both symptoms consistent with anxiety and ADHD at the same time, I would try to address the underlying ADHD first, because we rarely treat children with anti-anxiety medications. Most of the times, anxiety can be dealt with counseling, with different techniques, with meditation or mindfulness practice. And I will definitely go over mindfulness for anxiety and ADHD on a separate video. So what I would usually recommend the family is to get at the ADHD symptoms under control first. And if anxiety symptoms persist to a significant enough level that is not addressed by the current ADHD treatment, then we can seek counseling. Medication for anxiety is really as a last resort because they work very differently from ADHD medications. They don't necessarily interfere with medication that's used to treat ADHD, which are typically stimulants. Medication used to treat anxiety in children are often called SSRI, which stands for serotonin uptake inhibitor, selective serotonin reuptake inhibitor. And these are the same medicine that we use to treat adults with anxiety. By the way, they are pretty much the same medicine that we use to treat depression. Unfortunately, we have an airplane flying by. That's something that I did not anticipate. But I hope you can still hear me okay. Anyway, usually I don't use medicine to treat children with anxiety because I don't have a lot of experience working with these medicine. They can be taken concurrently with stimulants. And I do have a few patients who are taking both stimulants and SSRI medications. With significant clinical anxiety, I usually send a referral to a pediatric psychiatrist where they have the clinical experience in titrating these medicine. And sometimes actually they kind of take over the role of managing ADHD as well, because they are definitely also very experienced when working with stimulant treatments. So I hope that answers your questions. And like I said, in a separate video, we'll talk about mindfulness and meditation and the role they play in managing ADHD and anxiety. All right. Have a wonderful day. Bye-bye.